Okay, what I'm going to talk about is type 2 diabetes. So the definition is a metabolic disorder in which there is insulin resistance and impaired insulin secretion, leading to high blood glucose levels. So first is insulin is actually initially increased by pancreatic beta cells to try to counteract the insulin resistance. However, because of the progressive decrease in insulin production and secretion, leading to insufficient insulin levels. This combination results in hypoglycemia and type 2 diabetes. So type 2 diabetes is actually much more common than type 1, which is about over 90% of the diagnoses are type 2 over type 1. This usually occurs with between 50 and 60 years old, but starts around 45. However, with the increase in obesity, it has been more prevalent and has increased in children and younger adults. Determining if someone has type 2 diabetes, we look at their HbA1c levels, their fasting blood sugar levels, and then their glucose tolerance. And if they hit a certain range, then they would be considered diabetic. So someone with type 2 diabetes, some treatment that you can do is you can do lifestyle changes, which would be, having more of a balanced diet. So having some fiber-rich foods put in there, and then also the exercise. So they recommend 150 minutes a week of aerobic exercise, and then about 2 to 3 weeks of any type of resistance exercise. You can also treat it by medication, so an oral medication like metformin or the classic insulin. And then lastly, just monitoring that glucose. So either doing an HbA1c test or the classic finger stick test. So with that, as a PT, what we're looking at, if we know someone has type 2 diabetes and we are treating them, making sure when they come in, asking them how their levels were today or if they've checked them yet, looking at signs and symptoms before, during, and after exercise, just making sure, no dizziness, no frequent urination, they're, frequently drinking, or they have blurred vision. So just making sure we're checking on them throughout the portion that they have their visit. And if so, we can do something like sit them down. Hopefully they have a carb source in hand or something that we can give them to help them. But if it escalates to a certain situation, we can obtain more help.